The sacrum is present at the base of the vertebral column. It is obvious that the muscles present in this region will not only provide support but also allow movements of the lumbar region and the hip bone, also the thigh. So by observing the locations of these attachments on the sacrum, we can get an idea about the function of these muscles too. So let's have a look at these one by one. Firstly, if we look at the dorsal surface, the rough part of the ala is giving origin to the iliacus most anteriorly, lumbosacral ligament posteriorly, and ventral sacroiliac ligament to its margins. Now, this iliacus muscle is a triangular muscle that allows the flexion of the thigh. The lumbosacral ligament, as the name indicates, is the ligament present between the lumbosacral joint. Sacroiliac ligament is present between the iliac portion of the hip and sacrum, and it forms the chief bond of union between the sacroiliac joint. The attachments of the erector spinae is in the form of U-shaped line passing over the spinous and transverse tubercles. If you remember that, this is also called the spinal erectors, which is a set of muscle that straightens and rotates the back. And the area inside is giving origin to the multifidus. Now, multifidus are thin muscles that fill up the groove on the spinous processes of the vertebrae, helping to stabilize the joints of the spine. The lower narrow part under the auricular surface gives origin to the gluteus maximus. Gluteus maximus is regarded as the strongest muscle in the buttocks. It is obviously involved in the movement of the hip and the thigh. So to summarize, on the dorsal surface are the attachments of erector spinae, multifidus, and gluteus maximus. To help you remember, I have come up with an easy mnemonic. Remember the word gem. G stands for gluteus maximus, E stands for erector spinae, and M stands for multifidus. Moving on to the anterior surface, we have the piriformis, which gets attached like a monster claw laterally. These muscles help to move the thigh side to side, which is also known as the abduction and adduction of the lower limb. And towards the apex, the coccyx gets the attachment. Regarding the coccyx, it's basically a sheet of muscles and fibrous tissue at the pelvic floor. Now you're well versed with the pelvic surface. So these are the muscle attachments that we discussed, and we know that their significance lies in the movements that are occurring at the pelvic region and the lower limbs.